What I'd like to do is share with you a little bit about what our clients are saying about MedVA. One of the key things that we hear from our clients is really that they're satisfied with their virtual assistants. It makes a difference in their lives, difference in their practice, giving them more time back, added efficiency, also amazing cost savings. And so, as you can see here from these testimonials, a number of our clients are very happy with the services and really provide glowing references for us. To that point, we have almost a 97% client retention rate. We're really seeing some huge impact in the industry, and I think you'll get a lot of great information today about how to leverage a virtual assistant, virtual medical staff within your practice. A little bit about myself. My name is Chris McShanag. I'm the Chief Operating Officer and President of MedVA. Really drive the strategic direction of the business as well as the day-to-day operations. I'm very excited to have this opportunity to share with you today a little bit more about who MedVA is, as well as how to integrate virtual assistants into your practice. MedVA is a global virtual assistant company that provides high-quality strategic resources for your day-to-day administrative needs. We're very laser focused in the healthcare space. I think what we've seen, and you'll see during this presentation, is leveraging virtual assistants and virtual staffing is really a game changer for a number of our clients. So there's really 4 items I want to cover today in our webinar. How the medical labor force has changed. And I think we've all seen some change over these last few years. How a virtual team is a strategic solution. Really open up and share with you a little more about how a virtual team can really make a difference in your practice and in your work-life balance. Additionally, what I'd like to share with the team today is really medical workforce is revolutionizing the healthcare industry, and share with you a little bit about what our clients are saying, as well as what we're experiencing as we are growing our company. And then ultimately, I want to provide you a guide as seamless as possible on how to integrate a virtual team into your practice. So just to give you a sense, we talk about how the workforce is changing. What's really surprising to me is I did the research in preparation for today's webinar, that the burnout rate is almost half of all physicians in the US, and it's rising. No surprises that it's gone up in the last couple of years, but it continues to rise, even to the point that the American Health Association is calling this workforce shortage a national emergency. And I tend to agree, as I deal with doctors and nurses and health practitioners on a daily basis. It's really becoming a huge strain on the industry, particularly the amount of administrative work and tasks that our physicians, doctors, and clients really need to take on. So that's really on the healthcare space. So let's look at one of the other big problems that we see. Not only are we seeing changes, but a huge great resignation is taking place. In the last year, we've seen 1.7 million folks resign from their current healthcare jobs, which is really hard to fathom when you think about the need that we have in the healthcare space, particularly coming out of the pandemic. Taking into consideration, that's just in healthcare. And so industry says it's somewhere 5 to 7 times that amount, and healthcare is definitely well above the average. Now let's hear from the experts on what they're forecasting is going to occur in the next 2 to 3 years. And we're seeing that 1 in 5 physicians are likely to leave their practice within 2 years. When you take into consideration that, as well as the burnout, we really have a struggle that's appearing in the healthcare space. On top of that, 2 out of 5 nurses are also likely to leave their practice within 2 years, putting added burden not only on the physicians, but also the other staff. To overcome that, we've got 1 in 3 admin staff are actually planning on leaving, so almost 33%, a third of the workforce. When you think about, we spend somewhere around $1 to $1.2 billion on administrative tasks and effort in the healthcare space, averaging almost 9 hours a week for our physicians. That's going to become a huge burden on top of, obviously, the burnout that we're now experiencing today. So I'd like to take a couple of moments here, and we want to take a poll just to see if this resonates with the webinar and our participants today, because I think there's a unique opportunity that's really about us. And I want to get a better sense of what our participants and other folks are seeing in the market, as we kind of heard from some industry studies. It's appearing like staffing struggles continues to be the major concern. And obviously, we're seeing from the great resignation that is a huge problem. Also, the cost and time of administrative tasks. As I mentioned, I was recently reading a study. And when you think about what we're seeing really across the news, not only from an inflationary perspective, as well as the increase of minimum wage is really putting a huge toll on a lot of our doctors. On top of that, what I recently just read was that 5% reduction in Medicare for our physicians. And so that's really going to burden. So not only are we now seeing, as the polls coming in, almost 60% of staffing struggles, But on top of that, the cost and administrative tasks are also a big issue, thereby, really having a huge impact on the cost side. And then now we're seeing is the government is starting to put pressure on the reimbursement, really a colliding effect. As you can see from the results, clearly staffing struggles is the big area, is the big concern, followed closely by cost of time and administrative tasks. And so what I want to talk to you today about is how we can help really with those staffing struggles. And I think virtual solutions and virtual staff is the answer. And let's talk a little bit about the difference between that and in-house. Obviously, the traditional model is very much an in-house model, but that's an opportunity, I think, that arises for us to really look at virtual staffing. What are the benefits of that? Look at value for money. On average, it's at roughly around a 70% cost savings on leveraging virtual staff. Proven vetting process. So there's really no concerns around having to vet the VAs. We take that burden off of you. We vet the VAs, we recruit them, we put them through dedicated training as well as an endorsement process to really help you be prepared for your virtual staff coming on board. Reliable staff. I think the key thing there for us is we really take on that responsibility to help manage and ensure that the staff are appropriate and endorsed and trained, HIPAA compliant and ready really for the work. Folks are very dedicated from a work ethic perspective. That's another thing you are seeing with the staffing struggles. It's hard to find not only staff, but also good staff that are dedicated and consistent. Zero overhead costs. And so one of the obviously huge burdens, not only when you bring somebody on board in an in-house situation, you also got the cost of real estate, technology, benefits and overhead. And really take that burden away when you leverage virtual staff. Zero liabilities. And so really what that is we take on the responsibility from a human resources perspective, making sure our team is compliant, has all the right tools and training to really be efficient and working effectively in your practice. And so as you can see here, virtual staffing really ticks a number of the boxes as it compares to in-house staff. So given that, I really want to talk to you about how the workforce from a medical perspective and virtual is revolutionizing the healthcare industry. What we've seen, of course, through COVID and the pandemic, everybody got very comfortable working from home, but the work still continued. And so what we've seen is a huge uptick, particularly across our team and the medical scribe, receptionist, admin staff, and billing specialist. They're just the four main things that our clients leverage us for today. That's not to say that there aren't other areas that you could leverage a virtual assistant. Actually, a number of our clients are being very creative with their virtual assistants and how they can better leverage them on the marketing side. Referrals marketing. Actually have one of our clients who leverages their virtual assistant to zoom into doctors' offices that refer to them, have donuts delivered via DoorDash, and really makes a unique and special experience. And you're able to touch multiple practices and multiple clients at the same time. So what I'd like to do is take a couple of minutes on each of these topics, really to walk through each one of them, because one of the questions we get asked a lot when we're talking with our clients is, what can a medical scribe do? What really are the tasks involved in medical scribing, administrative, billing, and receptionist, given that these folks are remote? And so, from a medical scribe perspective, this has really been a game changer for a number of our clients because they're able to take additional time. As you can see here from the quote from Dr. Graves, she's been able to spend more time with her family, not have to take work home. One of the unique tools about leveraging our virtual scribes is they not only conduct live charting during the patient visit, but also they're preparing the chart ahead of time, updating it during the visit, but also helping close it out so that when the doctors finish with their appointment, they're able to review the chart. It's already been updated. All the orders are in there. They just have to do a quick review and then able to submit those for medical refills and kind of the ability to create referrals. And so I think the key message here that I've seen from a number of our clients is that they see their patient volumes leveraging a virtual medical staff up 20 to 30% from a scribing perspective, and really improvement in how they're able to manage their patient visits. And so what we traditionally do is either if it's a telehealth visit, our virtual medical scribes will zoom into the meeting, or if it's in practice, they're also able to join via Zoom and be part of that conversation with the patient, completely HIPAA compliant, no concern about PHI. We make sure that all that security is in place and allows the physician really to be hands-on talking with the patient without having to worry about being behind a computer. The second main area that we see our clients leveraging their virtual team members is in the insurance verification. I know we all know that one of the struggles within healthcare is being able to work with, and as efficiently as possible, work with health insurance companies, and dealing with the paperwork, as well as coordinating patients and their benefits and verification before certain orders and labs can be ordered. And as you can see here from Dr. Hansen, he was able to leverage a virtual assistant. One of our premier virtual assistants, Chin, could take care of tasks that normally would take him days or weeks. He was able to get done in a fraction of the time. What we've seen is really an improvement anywhere from 70 to 90% process efficiency by having folks dedicated to this task, and also from a cost perspective, being able to leverage multiple virtual assistants for essentially the same cost as an in-house staff member, thereby being able to ensure that the insurance piece, paperwork, and administration is taken in a more time-effective manner. So the third area, and probably the largest area that our clients leverage their virtual assistants, is as receptionists. The huge call volume that a lot of our doctors and dentists are receiving today is just amazing. As we come out of the pandemic, there's a lot of pent-up demand, particularly in those procedural-based elective clients of ours. And so one of the things that our virtual assistants are able to do is be dedicated from a phone call, patient communication, and managing the appointments, handling a number of the clinical tasks. And really what we've seen across that is call volumes have increased anywhere from 30 to 40%. And the key part that I also want to highlight, and as you can see here from one of our office manager clients, is the client satisfaction. We hear over and over again that our doctors are very pleased on leveraging their virtual assistants, because what that allows is their patients to get in touch with their office and get things scheduled. Whereas before, patients were frustrated, couldn't get in touch with the office, loved the doctor, but just couldn't get time with the doctor or get somebody to answer the phones. Now that becomes a seamless process. Our virtual assistants work their business hours, either on the Pacific or East Coast, whatever the clinic's requirements are. They handle the calls incoming and outbound, and it's a seamless process. We leverage voice over IP, and patient calling really has no idea that it's going to folks outside of the US, because the phone number is exactly the same. When we call them back, it comes out as your clinic's phone number. So there's really no concern from that perspective. And then the fourth major issue or opportunity that we see our clients leveraging our virtual assistants is in the billing space. Particularly, once again, dealing with insurance companies, billing, claims, invoices, kind of denials management. As you can see here from one of our clients, really been overly impressed with the team as well as the results. She's experiencing anywhere from 20 to 25% increase in her reimbursements and severe reductions in her AR days. One of the key items that we quite often get asked from our clients is, how can we ensure that folks in a virtual assistant that are working remotely are actually working? And so as you can see here, one of the comments from Juliana is just perfect attendance and very professional. And you'll experience that with each and every one of the folks that you meet and work with from MedVA. So we talked a little bit about what we're seeing and what's happening in the healthcare industry and the impact that that's having. Talked a little bit about virtual staffing, what it involves, and the areas that you can really leverage your virtual staff. What I'd like to do is kind of talk to you a little bit about the guide to actually onboarding your virtual staff. How do I get from I love this idea, I think this is a fantastic thing, to actually getting a virtual staff member as part of your practice? So really, we've made this process as seamless as possible for you, and we've intentionally done a lot of the heavy lifting. It's as simple as scheduling a call with one of our client relationship managers. They can better understand your needs, where you have the major pain points. At that point, we'll provide some virtual assistance for you via email, also providing a 1-minute video that you can actually view and see from our candidates. If you so choose, you're welcome to interview those candidates, or if you decide, hey, I really like that particular candidate, I think they'd be a great fit for our practice, then we can onboard them immediately, even within a 24-hour period, once you've chosen your candidates. And the other unique thing that we've done to intentionally kind of help guide our clients through this process is we've created a portal. As you can see here on the middle, it says enter the site. And the portal is built with rich data, both from a video as well as written perspective, to really help our clients navigate through this process, how you onboard the client, how you onboard the VA, what are some of the key steps that you need to take. And so here's a little more information about how you get started with your virtual team. And you can see one of our clients, Dr. Relman, really he spoke very highly about how professional the team is, how he's really enjoyed the customer service. And that's one of the things we really aspire to. And is to date, we've actually achieved a 97% client retention rate. And so really the key first couple of steps are to ensure that we can get you connected via the VPN and voice over IP. Obviously, greet your VA. Ensure that you take some time to share the tasks and expectations and the goals. It definitely goes a long way to kind of helping the VA get ingratiated, obviously introduce them to the team. We hear over and over again, not only are the physicians very excited and happy to have virtual assistant support, but also the office staff. It takes away the burden of the day-to-day administrative tasks that they normally have to do and allows them to really focus on what they're trained for and what they desire to do, which is to take care of patients. In addition to that, we really ask as we invest in time and effort to train and bring the VAs on and recruit them and put them through a vetting process. We encourage our clients to take some time to educate them on the business processes that you have in your practice, because quite often they're very unique to your area and your practice. As I mentioned earlier, we also have personal relationship managers, which becomes your point of contact into MedVA to really leverage the skill set and the broad depth and knowledge we have. And if there's any of an opportunity to require additional coaching or training for our VAs, we have VA managers that are dedicated to our VAs to enable evergreen training and coaching that goes on. What I would encourage you to do is that really in the first couple of weeks, spend some time. It normally takes probably 1 to 2 weeks to really get your virtual assistant up to speed. We encourage you to pick 3 or 4 tasks that you really are major pain points within your practice and have them work on those. And then as they get more comfortable, kind of expand that skill set and expand those responsibilities. One of the other things we do is we intentionally connect with you on a regular basis. And so we conduct monthly meetings just to check in and make sure that things are going well. And we ensure the relationship continues with our personal relationship managers, as well as engage in opportunities to expand the VA's capabilities. Because what we've found from our clients is that once they get their first VA, it becomes a seamless process, and then they need more and more, and there's more and more tasks that they can offload in an efficient manner. I wanted to take just a moment to talk to you a little bit about time tracking and billing, because that's one of the questions we do get a lot from our clients is, how do I know that these folks are actually working and being productive? We've invested in an industry-leading technology called Time Doctor that captures our medical virtual assistants' productivity. We provide those reports on every 2 weeks in alignment with your invoices. And then we also make the billing process seamless, and we leverage secure ACH and credit cards for payment on a twice monthly basis. And so our goal is really to do as much of the heavy lifting as possible to really help you leverage your virtual assistant in a timely fashion and be able to enjoy the productivity and cost savings that all of our clients have really been able to take advantage of. Here's a number of our onboarding specialists will be made available for you. And really they're here to guide you through the process. So one of the questions is, there appears to be a lot of virtual staffing companies out there. They're not all the same. Let me tell you a little bit about why I see MedVA, and I'm so excited to be part of MedVA and leading the organization. Because we've intentionally, as I mentioned, invested in personal relationship managers, building the relationship with their clients, making sure they're comfortable leveraging virtual assistants, as well as investing in our virtual assistants on a regular basis. And one of the things we've done, we're actually paying above market rate for our virtual assistants, as well as providing them health and retirement benefits, which has driven an amazing retention rate of our VAs. And we figure if we really invest in our VAs and their loyalty, then they'll be loyal to our clients, prevent less turnover, and then provide obviously longevity of the service. A little bit about how MedVA got started. We're founded by 2 amazing physicians, Dr. Stephen Kupferman and Dr. Omid Shaye. And really they intentionally grew the company and started the company out of a need that they were seeing in their practices, where they were continuing to struggle with being able to keep up with all the administrative tasks and not being able to take advantage of the patient care that they really wanted to do. Dr. Kupferman's an oromaxillofacial surgeon, and Dr. Omid Shaye is a gastroenterologist. And they've really seen it to be a huge difference, not only in their practices, but in their family lives, being able to spend more time with their family and still be able to take care of patients and the patient volume that they see in their practices. And so that both doctors are very involved in the business, and hopefully if time permits, they're both in surgery today, and they may, if time permits, join our webinar for some of the Q&A. But rest assured, if there's ever a question you have, they're more than happy to jump on the phone and talk to you a little bit about their experience, as well as share with you some of the differences they've seen in their practices leveraging a virtual assistant. So then why choose MedVA? And so these are just want to give you a sampling of the results that we've collected from our clients. Over 150 million in ROI. When you start to think about the cost savings as well as the increase in reimbursement and patient volume, we have 700 plus team members spread across the globe, majority of them in the Philippines, but we also have capabilities in Latin America to support our bilingual client requirements, as well as we have over 400 satisfied clients, and we continue to grow. Actually, we're growing approximately around 50 clients a month. And so very impressed with the growth, and really the need is out there, as we saw earlier from what's taking place with burnout and staffing shortage. And we saw from our poll, almost 2/3 of folks are struggling with staffing. We've intentionally decided to invest in our VAs and invest in high quality VAs to provide to our clients. So someone will ask, why the Philippines? And as you can see here, the Philippines is an amazing country, as a number of you probably interacted with. Very strong work ethic, very strong customer service. Additionally, they're the third largest English-speaking country in the world. And so we've really focused on the Philippines because of that, as well as their focus on education and the healthcare. And so 75% of our workforce are actually registered nurses. And so we're very impressed and proud of the quality of our virtual assistants, and our clients continue to talk about how professional they are and how dedicated the team members are. So really our quality promise to you is that we'll recruit, vet, and train high quality VAs. We're providing industry-leading time capture solutions, onboarding our VAs within a 24-hour period. As we saw from our survey, staffing struggles are a huge issue, and we're committed to doing that. We'll replace your VA at any time. If there's any concerns, we're happy to switch out our VAs as appropriately, as well as we provide dedicated personal relationship managers to support you in this journey. So a couple of the four main takeaways I want to have you take away from our discussion today is burnout is growing at an alarming rate. As we saw that it's at 40, it's almost 50% and growing. In-house staffing is not the only solution. As we saw, there's so many tasks that you can leverage a virtual assistant for at a cost-effective manner. Integrating a virtual team can be seamless. As we've shown, we provide the heavy lifting and make it as simple as possible to bring your virtual assistant on. I believe in my heart that MedVA is the answer for your virtual staffing needs. So what we'd like to do to extend the folks today that joined our webinar is an exclusive offer. If you sign up by December 9th, we're offering 20% off your first month when you hire your VA. We really look forward to having you be part of the team. I'm sure you'll experience amazing results, as all of our clients have, to be more efficient, less stress, and overall satisfaction. So please scan the burnout code. Please scan here and book a call leveraging the code burnout. And also take a moment to thank everybody for their attendance today in the webinar. Hopefully you learned a lot. I would encourage you to go book a call, and look forward to the opportunity to get to know you more, speak with our client relationship management, and welcome to the MedVA family.